The common cold isn't just a nuisance for the nose, but the leading cause of doctor visits and missed days from work and school. The average adult gets 2 to 4 colds per year, while children average 6 to 10. There's no cure, but with the right weapons in your medicine cabinet, you can effectively treat the symptoms. And here to show us what those are is Dr. Ilana Levine, primary care physician and spokesperson for the American Academy of Pediatrics. Great to have you with us, Dr. Levine.
Thanks, Rebecca.
And this is just, I mean, it's one of the biggest nuisances. It can be horrible for parents, horrible for kids. So let's talk ingredients first before we get into what to have. What do you want to look for in ingredients?
Okay, so you want to make sure you have something that's going to make you feel better. And if you have a fever, if you're feeling achy, you want to have a pain reliever, fever reducer like ibuprofen or acetaminophen. You want to make sure that you know what you're taking, though, so you know what the dosing interval is, because ibuprofen is every 6 hours, but acetaminophen is every 4.
So it can be different even if you think you're working towards the same function. So a pain reliever, a fever reducer, for example, pay close attention to the label. When it comes also to other things, like, for example, congestion, what do you want to look for?
Okay, so for adults or children over the age of 4, you can use a decongestant. The one that I like the most is the ingredient pseudoephedrine, and this isn't commonly on the shelves. This is something you have to talk to the pharmacist about and get behind the shelves. But for children that are under the age of 4, you can use what we call nasal saline drops and a bulb syringe. So you can sort of loosen up the mucus with the normal saline and then suck out the mucus with the bulb syringe. It doesn't sound so great, but it actually works well, and it's much safer than using cough and cold medications that have not been shown to be effective in young children.
One more question on decongestants. So we're saying for children you have to be very careful, but when it comes to adults, is the stuff behind the counter what you want to go for?
That's what I like, and that's what I take and recommend to my patients. I think it works better.
It works better. That is good information, because I always wonder when I'm looking at the aisle to go with this or to ask the pharmacist to get what's behind the counter.
And it's very confusing because a lot of medications have multi-symptom medication, and they have lots of ingredients. So it's really important that people educate themselves and ask their pharmacist if they're not sure what the ingredients are, because you also want to be sure that you don't double up on things. I'm a big believer in single ingredient medications.
Like cough suppressants, for example. Let's talk about those.
Okay, so there are lots of cough suppressants out there, and again, for adults, you can take dextromethorphan, talk to your pharmacist, see which one he recommends for what your symptoms are. But for young children, again, you can't use cough and cold medication. So for them, I recommend honey. A teaspoon of honey goes a long way. Scientific studies show that it's actually just as effective, if not more effective, than cough medicines.
And lastly, running a cold mist humidifier, for example, you say can be useful for treating the symptoms.
Exactly, especially in those young children who can't take medication. It moistens the air, it helps make them feel better, and definitely will help them with a better night's sleep.
A better night's sleep, and that's what so many parents are going after here. When it comes to dosing, what do you have to think about for making sure that you're giving the right dose to your kids and for yourself?
Right, so the most important thing is to have proper dosing utensils. So if a medication comes with a dropper or a syringe or a cup, you want to use the one that came with the medication. The other thing that I recommend is that you write down what medication you gave and at what time, because it's the middle of the night, you have 2 caregivers sometimes, you have a cold, you're in this foggy haze, and you can't remember what you took when. So it's a good idea to write it down.
Great advice, Dr. Ilana Levine. Thanks so much for being with us. And for more on choosing the right medicine for your cold, go to our partner in health, WebMD.com, and search cold medicine.